Okay, so would discuss module one, which entails a detailed discussion of what home caregiving is about, the kind of persons that receive home care, the qualities of a home caregiver, and we'll discuss the entirety of the components of the home care team. So by way of introduction, many healthcare and support services really can be provided outside of the traditional healthcare environment, such as hospital, the skilled nursing facility, rehabilitation center, or long-term care environment. And receiving care within the home would allow individuals to remain in the comfort of their own residence, surrounded by loved ones, while their healthcare and daily living needs are still being met. And patients who receive home healthcare services have a team of healthcare workers who work together to help such patients and their families manage their needs. And as part of this team, the personal caregiver plays a vital role. The caregiver, if I may say, is almost at the center of the home healthcare team. And by virtue of being a caregiver, you have the chance to get to know your patients and the family in a very personal and special way as you work with them to meet their healthcare and daily living needs. And it would also interest you to know that home caregivers and the personal care to see them. So what is home care? Home care simply means supportive care that is provided within the home. And it allows the person to remain in the comfort of their own home while they're receiving services to recover from illnesses, injury, or disability. And home care services are also provided for people who have chronic conditions like heart failure, kidney failure, and the likes. Home care may be provided for people who have cognitive or physical disabilities with the aim of helping them complete their activities of daily living, which they may not be able to do on their own unaided. And it may also be provided for persons who are on hospice, those with end-of-life conditions. Hospice home care is for patients who have been diagnosed with a terminal illness. And usually they will have a prognosis of about 6 months or less. And the hospice home care would allow for persons with such a terminal condition to remain in the comfort of their own home, surrounded by familiar people or things while facing a terminal condition. People who receive home care would have a variety of needs depending upon their physical condition and or the specific disease or injury they may be suffering from. And such patients may need reminders or help to take their medications. Oftentimes they will need assistance with ambulation walking. They may need assistance with being transferred from the bed to a chair or a wheelchair, or even getting in and out of the bathroom. And many patients have adaptive equipment such as walkers, wheelchairs, canes, and prostheses that will assist them in moving about in their own home. And often such patients would also require help with activities of daily living, such as toileting, bathing, dressing, and eating. Some patients will need help with managing their budgets and with purchasing and cooking foods. And patients may need assistance with changing simple dressing, making and changing their bed linen, doing laundry, and maintaining a clean and a safe home. So then, who receives home care? Home care services is provided to people of all ages who are recovering from an illness or an operation or an injury with the aim of them remaining in their own home and avoiding unnecessary hospitalization or in a skilled nursing facility placement. So the home healthcare provides support for such persons with physical or mental disabilities so that they may remain at home, out of an institution or a long-term placement care. And many chronic conditions are complex to manage really, and they will require the use of various technological devices and equipment. Could be glucometer machine, could be blood pressure monitor, and some other adaptive equipment like the wheelchair. And many people have conditions that will require special diet to be prepared and followed. Thus, home care giver will be needed. Then assisting patients with chronic diseases to manage their conditions within the home would allow them to enjoy independence within the comfort of their own home. And patients who have recently had surgery may also continue to recover within the comfort of their own home while receiving supportive services to manage wound dressing, complete their medications or antibiotics, and regain their strength and stamina while they recover. Adolescents and children may also receive home care services to recover from illnesses or injury, or to receive assistance with activities of daily living. Now, newborn who are at risk, children and teenagers who are also at risk may receive home care services in order to prevent them being placed in foster care or institutional settings. And an increasing number of people are receiving home care services now. One of the primary reasons for this is that the cost of medical care in hospitals is rising. And there's also, to some extent, volume of patient versus skilled medical personnel needed. There's that gross and disproportionate division. Personnel are not adequate. And patients are oftentimes being discharged from hospital sooner than they have a chance to fully recover. So that way, home caregivers who have been adequately trained can come in as an intermediary to help such patients cope with whatever it is they will need while they regain their strength. And the truth is, this patient will often have complex needs and they require support as they recuperate from whatever illness they may be managing. There's a steady increase in the aging population, and many of these elderly ones will have numerous health issues and needs. And the truth is, family members may not always be able to provide the care that these patients will need. Some families may live very far away. They may have work engagements, responsibilities. They may need to take care of their own small children, which will make it very difficult for them to provide the adequate care for their loved ones who are elderly. And sometimes family may not even be able to provide some of such care, but they may benefit from the respite that a home caregiver would provide, both the emotional and the physical stress that a caregiver will be able to take off the shoulders of the family members. So now the home healthcare team, who makes up this healthcare team? It's usually provided by a number of persons, including licensed medical personnel such as physicians, registered nurses, licensed nurse practitioners, physical therapists, occupational therapists, speech and language pathologists, registered dietitian, medical and social workers, respiratory therapists, wound care specialists. And unlicensed personnel such as home health aides and personal care aides are vital members of the home healthcare team. And every member of the healthcare team has a role to play. Now, it's important to also know that the patient and their family member are the most important part of the healthcare team. Patients have the right to make decisions about their healthcare. They have a right to be informed about the treatment and the care that they receive. They have a right to refuse treatment, medications, and even services offered. And all patients and their families, they are unique and have various needs, desires, cultures, and traditions. It's important to know that. And it's important that the healthcare team respects these individual differences and work to meet each patient's need. Because really, without the patients, there can be no healthcare team. So what are the tasks that a caregiver will perform within the healthcare team? Caregiver would typically provide assistance to people with everyday tasks so that they can be as independent as possible while remaining in their own home. And typical tasks would include bathing, dressing, assisting the patient with using the bedpan, urinal, commode, or toilet. You may also assist in cases where it is indicated with purchasing and preparing food and assisting the patient with eating during meals. And you may also participate in healthcare activities such as taking vitals, checking blood pressure, pulse rate, respiratory temperature, and they can also assist with prescribing medications, with administering medications under supervision. It's important to know that the healthcare aid and the personal care aid keep accurate record of services that they provide and the tasks they complete. If it's not documented, it's assumed that it was not done. And the home healthcare aid and the personal care aid record of their patient's progress and reports any changes in the patient's condition to the supervisor. So while you make your notes on what has been done for the patient, if the patient's status changes, writing it in the patient's notes doesn't help much if the supervisor or the other members of the managing team is not aware. Like the managing doctor does not know that the status of the patient has changed. While the caregiver will document, it's also important to carry the information across to the other members of the team. So what's the scope of practice? Scope of practice would define the task that the healthcare workers are legally allowed to perform. For example, there are some procedures that a caregiver may perform because they are considered, may not perform because they are considered to be outside their scope of practice. So that would also be covered in within this module, but not this presentation. Now, what's care plan? Care plans, they are prescribed treatment and services that the patient will receive, and they are developed from input from all members of the team. And there may be many care plans for a patient who has many needs. For example, a physical therapist will develop a care plan for mobility needs. After assessing the patient, the dietitian will develop a care plan for nutritional guidelines for the patient to follow. The supervisor will coordinate the care the patient will receive. And it's important that the instructions written on the care plan are followed to the letter. This ensures that the patient receives the proper and the safe health care they deserve. It also protects the agency from undue liability. Liability means that the employee or the agency for which they work can be held legally responsible for harming a patient. It's as simple as that. So that could be as simple as the caregiver not performing what was written in the care plan. The agency and both the employee as well may be liable for such negligence. Now, care plans are updated regularly to ensure the patient's needs are being met, because as each day unfolds, the patient's state of health many times will change, hopefully for the better. So care plans are updated in view of that, and they are also updated when there are changes in the patient's condition. And as the person on the healthcare team who spends the most time directly with the patient, in this case you, the personal care attendant will have a first-hand knowledge of the patient's condition, and it is important that they immediately report any change in the patient's condition to the supervisor so that such changes can be documented and the care plan can be adjusted appropriately. For example, if a personal care observes that the patient is weaker than a previous visit, and this can put the patient at the risk of a greater fall, it's important that this observation is documented and reported to a supervisor such that the care plan can be adjusted appropriately. Though. Even changes in the patient's behavior, unexplained bruises, skin breakdown, and the likes. These will be important observations to document and then inform the supervisor about. While patients always have the right to refuse treatment or assistance, it's important that the caregiver documents this refusal. So a patient verbally refuses and is not documented can still be considered liable. It's only the documentation that is legal backing for such a refusal of treatment. So if a patient refuses any form of treatment or assistance, it's important that it's documented, like a patient refusing to be bedwetted or refusing a particular dose of their medication. It's important it's documented and the caregiving team, the home health team is carried along. And if at any point as a caregiver you are unsure of what to do in any situation, please talk to your supervisor. And it's important to follow the care plan and instructions from supervisor to protect yourself, the agency you work for, and most importantly, the patient. So what are the qualities of a personal care aide? Taking care of someone requires that an aide has a very good physical health, because what you don't have, you cannot give to someone. So assisting a person to walk, get into a wheelchair, have their bath, completing household tasks such as cleaning and cooking can really be physically demanding. So it's important that first and foremost, that a personal care aide takes good care of their physical health and protect themselves against injury. Then grooming on a regular basis is important to maintain good physical health and appearance. It helps a person to feel good and show others that they care about themselves and others. If you look good, if you smell good, if you look fresh, generally, then of course it goes without saying, having your bath, teeth, brushing your teeth, deodorant, keeping your hair and facial hair well groomed are important to help the caregiver care for themselves first and then others. Your uniform should be freshly washed. It should appear neat, without rips, without tears, without stains. Long hair should be tied, held back. Jewelry should be to a minimum. Makeup should be kept to a minimum. And strong perfumes should be avoided because some patients may find this irritating. Fingernails should be kept trimmed and clean. Artificial nails would harbor bacteria, so it's not allowed, it's not acceptable. And hand hygiene is extremely important as it is the best way to prevent the transmission of infectious diseases to your patients, to yourself, from patient to patient. And gloves should be worn when providing patient care. When you may come in contact with bodily fluids, the patient's saliva, the patient's urine, fecal matter, vomitus, whatever it is, if you have to come in contact with a patient's bodily fluid, please wear a pair of gloves. Providing supportive care also requires that the aid be dependable, be organized, be responsible, be trustworthy, be patient, be caring and compassionate. As you'll be working with people on a daily basis, it's also important to be people-oriented. You will need people skills. And it's also important that such an individual enjoys working with other people because you're working with people, you must like people. And patients and families would allow home caregivers to come into the privacy of their own home and take care of them in a very personal way. So it's important that such a caregiver is trustworthy, is honest, and is respectful. And this means that they must respect a patient's right to refuse a treatment or care, right to privacy, right to practice any customs or tradition or religion that they find important to them without judgment. Thank you. So this covers this module. At the next session, we'll discuss more on the healthcare team. Thank you very much.